This video is in regards to meniscal repairs, whether we should do them and when they should be necessarily used. When we look at a knee joint, we have the top bone, the bottom bone, the tibia, and the blue is the meniscus in between. When you tear the meniscus through a sporting accident or just degeneration, you can produce different sorts of tears. We know that going through and trying to stitch and repair the meniscus unfortunately has quite a high failure rate, and the literature suggests that anywhere between 30 to 60 to 70% of meniscal repairs actually fail, meaning you've got to go in for more surgery. The meniscal repairs, the meniscus injuries that we shouldn't think about trying to stitch or repair are a bucket handle tear. And a bucket handle tear is, as the name suggests, is you get a tear through the meniscus. It's almost like you can pull it up like a bucket handle, and they do badly repairs where you try and stitch them. The second type of tear that does poorly with meniscal repairs is a complex tear. As the name suggests, complex meaning there's lots of little tears through there, and like a complex, even a complex injury, say to the skin, it's very hard to stitch complex tears. Those two sorts of tears, a bucket handle as well as a complex tear, generally do much better with an arthroscopic debridement, or they literally just cut that part out. There's another type of tear which sometimes a lot of specialists and so forth may feel that is good to repair, and that's a tear to the posterior horn of the lateral meniscus, and that's called a posterior root tear. And those tears actually do quite well without even operating. We leave them. So I think it's very important to understand that the take-home message from what I'm explaining today is that meniscal tears have a high failure rate. They should not be used in a bucket handle tear situation or complex tear, and with a posterior, a lateral meniscus posterior root tear, which is a tear in this back part, they're not needed, and the tear actually, the separation heals quite nicely with conservative treatment and no surgery. One of the problems with meniscal repairs is that the repair substance, which is a bit like a twine that you would use to stitch a problem on the skin, it stays in situ. It doesn't dissolve in the vast majority of cases. It will stay in your knee. If you're 30 years of age, it will stay there for 60 years until you're 90 years of age. It stays there for a long time. Unfortunately, as you can see from this video, this is a video of an arthroscope inside of the knee, and you can see when we take this video, this white substance here, this is the stitch of how large that stitch is. It's enormous, and these stitches float around inside the knee, and as you can see, are quite damaging inside the knee. And this is another arthroscope of somebody who's had the meniscus repair, and the stitch here stays inside the knee, and you can see the mess of the stitch through this area here, and this little probe will show you the actual stitch here floating around in a normal knee. And one of the big problems with stitches like this is that it not only does it cause lots of inflammation, but it can also damage the bone on the top part. And so consequently, we know that in a high percentage of cases, meniscal repairs can produce problems. And the take-home message from this is, if you're going to have a meniscal repair done, make sure it's not bucket handle or complex. Make sure it's not the posterior root of the lateral meniscus. And finally, make sure you speak to a good, credible knee orthopedic surgeon who has a specialty in this area, and again, decides on the right type of operation for you. From a clinical perspective, from my perspective, I see quite a lot of patients who have failed their physiotherapy and come and see us with meniscal repairs, and they ask me what we should do with these. Unfortunately, with a patient like I've just shown you on the video, they then go back and have another surgery to take out the meniscus. To take out the stitch, because that actually causes damage within the knee. So take-home message with these sort of things is that err on the side of caution with meniscal repairs. We think that they're probably overdone in the community with orthopedic surgeons, the less experienced orthopedic surgeons. And finally, there's some particular meniscal tears that shouldn't be repaired, and be cautious when considering a meniscal repair over a partial meniscectomy where they trim the meniscus. Look, it would be better if we could try and save the meniscus with stitching it. That's a great textbook solution. However, the reality is that up to 50% end up having more surgery and also cause collateral damage within the knee. I hope this is useful.